Good afternoon, everyone. Thanks for joining us today. We are going to be starting, this is the first part of a 5- or 6-part webinar series, and we're beginning with Going Social for National Health Center Week 2016. This is a collaboration between the Advocacy and Communications Department, and soon you'll be hearing from Marisol Murphy-Ballantyne. She is the Assistant Director of Communications and really helped put this presentation together, but we wanted to kind of go over the strategy for how you would go about developing your social media calendar, what tools to use, things like that. So we'll be going through all of that today, and then we're going to continue the series probably about every month or so, probably covering National Health Center Week for a while, but things that are related to communications and social media around kind of the events of the time. So without any further ado, I'm going to pass the ball over to Marisol, and she can kick us off.
Hi, everyone. I hope everybody's doing well. Today, I wanted to talk a little bit about building a social media strategy for your National Health Center Week communications activities. Social media is a very important tool in your communications toolbox, as I'm sure a lot of you know. It's an easy and inexpensive way to spread the word about your events and the value your health center offers to your community. Just, according to the Pew Research Center on Internet Science and Technology, 65% of American adults are using social networking sites. It doesn't matter whether they're urban, rural, or suburban, people in your communities are using social media for not only for information, but also to connect to the organizations and brands that they love. This can be obviously a very lengthy topic, but I hope I can give you some insight and some tools that can assist you as you plan for National Health Center Week. So to begin, it's really important to start strategizing early and looking into what you've done in the past. So start with research. Health Center Week is not new, and so I know a lot of people already do and plan many activities. I've seen them on social media myself, and we try to share them throughout National Health Center Week in our social media channels here at NAC. But have you thought about your capacity and about what you've done in the past and what's been successful and what hasn't been successful, and also what tools you have in your social media toolbox? Are you using all the platforms or just one or two? These are things you really need to think about when you're putting together a strategy. It's also really important to understand, as I mentioned earlier, capacity. Social media requires some managing and monitoring, posting and making sure that the messages not only are coming across the way you want them to, but also that you are engaging with people in your social media network. And so when you're researching, you need to really look at how much time you have. And social media is easy, and it can be, it doesn't have to be time consuming. If you plan ahead, you can really, be successful and get ahead, and you're able to maximize whatever capacity you have. And then, again, also just looking at what was successful and unsuccessful last year. You can go back on Facebook or Twitter and see what people liked. Is there an image that people really resonated with people, that they shared, that people commented on? Those are the types of things you want to find and use them and maybe improve upon them. The other thing is you should look outward. Find out what new platforms are out there. Are they useful to your organization? Snapchat is really popular right now, but it may not be useful to everybody. Pinterest is something I've seen a few folks on, a few health centers and PCAs on, and some of them use it very well, but then some people don't use them as well, just because, you know, having images for Pinterest board is kind of hard. You have to create them or you have to find them, and that can get a little difficult. Find out what new trends are out there. That's another really important thing. I don't know if you guys have noticed on social media lately, there is this new video craze. It's called the Running Man Challenge. So the Running Man actually is an old dance move, I think, from the early 90s. But some college basketball players in Maryland put together just a quick snippet of their version of the Running Man with an older song, and have challenged other folks to do their own, and it has taken off. And so there's plenty out there if you look up the Running Man Challenge, and that's sort of a trend. The other trend was a couple of years ago when the Happy song came out by Pharrell, and people started making their own Happy videos that were a lot of fun to make. You get a lot of people involved. They don't have to be high-tech, and that was just a trend. And actually, I think we may see something similar happen with the new Justin Timberlake song that was just released for some animated film that's coming out soon. The other thing is to look outward for hot button topics. What are some things going on maybe within your local community that you might want to avoid, or that you have a stance on that you want to talk about? Maybe you can use National Health Center Week and social media to talk about the social determinants of health, and how understanding that is really important to your community and what your community health center is doing. Because the social determinants of health is a really big deal right now. Also, don't be afraid to ask questions. Understand who it is that you want to reach. Who in your community? Is it just your patients? Do you want new patients, prospective patients between the ages of, 18 and 50? Understand, who your elected officials are out there, and where they are on social media, and what kinds of messages would be attractive to them, that would really resonate with them. And then also ask yourself, what do you want to accomplish this National Health Center Week? Setting goals is great, having objectives is great, and making sure that they're reasonable, and it's something that you can actually achieve is a good way to get going, and sort of planning around those goals and objectives will help you maximize your social media posts. Also, ask yourself, are your activities enhancing the overall organization objectives? Every year, I'm sure your organization, or maybe every couple of years, decides what their goals are and their objectives are. Know those, and see how your social media activities around National Health Center Week can enhance those objectives, or help reach those objectives. So, with social media, you can choose your own adventure. Again, I talked a little bit about platforms. Not every platform works for every organization. Here at NAC, we use Facebook, Twitter, Instagram, LinkedIn, Pinterest, and YouTube. And some of these we use well, and some of them we should improve on. And you don't want to stretch yourself too thin. So if you know that you can get more images, maybe you work with Instagram, because you know that you can get images, whether at the health center or during the activities that you guys do for National Health Center Week to promote stuff. If you already have a following on Facebook, don't ignore your following on Facebook. Use that. Twitter and Facebook seem to be the big ones, and most of the audiences, especially for NAC, are on those two platforms. So we use them for just about everything. So just pick whatever works best for you. As far as goals, have a purpose. Again, have objectives, have aims. Make sure your goals are measurable, and understand what works. To understand what works and what doesn't work. So for instance, if we want more people to come to a conference, well, how do we measure that if we're doing social media? We may add the question, you know, on a registration form for a conference that says, how did you hear about us, and make the social media part of that drop-down menu that lets you pick that that's where you heard about the conference. And then we can measure that. That's just one way to do it. But also be reasonable and aim high, but not so high that the goal or the aim is not achievable. You really want to make sure they're achievable. As far as messages, use the National Health Center Week site and customize those messages. Make them local. People really want things on the local level. They'll resonate with the people you want to reach if you keep them local. The National Health Center Week website has really great tools, and they have press releases and letters to the editor that you can pull key messages from and make them your own, as well as there's a whole PDF there with Twitter and Facebook posts that you can use. Take those tools and use them. And then as far as tools, remember that there's not just the Health Center Week site. There's other social media resources that you can use, that you can create on your own, or you can use within each of the platforms, whether that's a calendar or automatic automatic scheduling or tracking. These are all tools that you can use. And actually, I will emphasize the use of a social media calendar, especially if capacity is an issue. National Health Center Week is a really busy time and at health centers. People are running all week long, probably even before that week, running around tying up loose ends, making sure everything is covered. You know, you might have extra people on site that day. If you have a social media calendar, it's easier for you to get ahead of that and plan and schedule posts so that you're not tied to your computer or your phone when you're trying to do other things, and so that you don't forget to post at certain times. Having that calendar is really, really helpful for that. Also, you know, during National Health Center Week, as I'm sure most of you guys know, there are certain days that are recognized, Migrant Health Worker Day, there's Healthcare for the Homeless Day. So you can get ahead of that and plan for those days and have posts regarding, you know, that focus on those patients and what health centers do for those patients for those days. So I kind of wanted to go a little bit over this. So I kind of gone over just a little bit of what it takes to strategize when it comes to social media, and I really wanted to have an example for you, and so I created this little case study so that we could kind of go over it. This is not a real health center, obviously. MMB Health Center in Anytown, Maryland is holding a National Health Center Week Health Fair. Their objectives are to engage current and prospective patients and showcase their services and value to the community, and foster support of health centers among local leaders. They've done their research, and they know that they have a Facebook and Twitter. They don't really have the time to explore new platforms and try to build an audience. That's another thing that you should keep in mind. You know, sometimes it's a little harder to get started on a new platform during National Health Center Week if you don't already have an audience there. So just keep that in mind. Anyway, so they have decided to use Facebook and Twitter to promote their events. Their goals are to have at least one elected official attend the event, increase their event attendance, and provide a screening service to 25 new or prospective patients. Goal number 2 is a little vague. I should probably have added an amount there so that we could truly measure that. But these are just 3 little goals that this health center has decided they want to meet. So now we're going to talk a little bit about the messages, the key messages. So for each of your audience, you should really, you should create key messages that apply overall. But for each of those audiences, you might want to tweak them so that they appeal to those audiences, because what might work for an elected official may not work for a prospective patient. And just like something might work for a patient that you already have, it may not work for someone who doesn't really know about your health center. So it's important to keep that in mind when you're creating messages, whether for social media or communications in general. So MMB created this message for elected officials. Innovative health centers like MMB save the health system money while providing access to quality care. And then they followed it up with a call to action. So you always want to have a call to action. Tell people what you want them to do, and keep it simple and clear. And we want an elected official to join us. The health center wants an elected official to join them. So their call to action is join us during National Health Center Week 16 to learn more about how health centers contribute to our community. And it feels a little more local just because they included the word our. You're not talking about the nation, you're just talking about what are the impacts within your community that your health center, what is the value that your health center brings to your community? Current patients, you want to increase the amount, our MMB Health Center wants to increase the amount of current patients who are coming to the health fair. And so what they do is they say, at MMB Health Center, we love the community we serve and appreciate our staff and volunteer board members. Connecting it to the people that the patients already know will help get the people, the patients excited, because they're connecting it to people they already know, that they work with, that they have relationships with, that they want to be supportive of. And then the call to action is, come help us celebrate our community and get healthy during National Health Center Week 16. For prospective patients, it's going to be a little different because you're not sure if they know about you already. Maybe they've walked by a couple times, but they don't really know your mission. They may not really understand the community health center mission overall, may not really know much about them and the great services they offer. And so how do you get those people excited to come to a health center? The message MMB Health Center created was, MMB Health Center offers quality, affordable health care in our community. So I might change that to in your community if you want to really reach out to folks. And you want to make them feel, like this is a place within their community that contributes to their community, but will also offer them services that they could use. So the call to action is, come learn more about our services during our National Health Center Week Fair. Now, for the prospective patients, you might want to include like an image of, of an event that's happened at your health center, health fair in the past. If there's a photo of kids having fun on a bouncy castle or something like that, show them what's going on, or a photo of someone having a free blood pressure test and things like that, along with that message, to show them what they might see and encounter at the health fair. Continuing with this case study, so then you have a couple of tools. I'm going to talk a little bit about the tools that are available for free if you use Facebook and Twitter and a couple of other different platforms. So this here is actually where I hope you guys can see my mouse, is actually an event invite, and it's a feature that Facebook has. It's really cool. So particularly for, if you know that that an elected official is following you on Facebook, or even your patients and your staff that are following on Facebook, and you want to make sure that they know that this health fair is coming up, and you want to invite everybody that's, following. You can create this an event invite, and you can either specify the people that you want to reach, or you can just invite everybody and include information there, and then they can say whether or not they're coming. And that just sort of builds, when you get an invite from somebody and you go to the guest list and you want to see how many people are coming and who's going, sometimes you might be like, oh, so-and-so is going, and that's great, that they're a lot of fun. This looks like it's a great event, I want to go. It might encourage people, sort of that peer pressure thing. It might encourage people to show up because other folks are coming. And it's a way to build anticipation for the event. You can set this invite up, share it as many times as you want. You can post photos in there as many times as you want, messages, and then share those as well. People who are going or who are invited can then also share your invite with their friends. And so it's sort of a ripple effect when it's used. The other thing you can do on Facebook that's really cool is if you get verified, you can actually live stream. So if you are having an event during National Health Center Week, you can actually, with an iPhone or even an Android phone, you can stream via Facebook, and it's live, and anyone who follows you and likes you it can watch from any location that they're at. I actually used live streaming for NAC during the PNI at the Advocacy Awards session at the museum, and it was just sort of an experiment, but it was really easy. You just, say that you want to live stream. It asks you a couple of questions about what you're live streaming and a title, and then you just hit go and it goes. And then that video, actually, you've now created a video, because once it's over and you stop, it lives on your Facebook site. So it doesn't go away. Other people can then look at it too later on. This might be especially helpful if you have an elected official coming and or your C-suite folks are giving some sort of speech or talk, and you want to just capture that so that you can share it later. That's a really good way to do it. The other thing I mentioned earlier before is, every year we put together press releases and letters to the editor and op-eds. Those messages you can take and pull information out of, and pull, you don't have to use them in their entirety if you don't want to, but they're also really good for just pulling key messages and putting together, tweets and looking at language that will work, and then, localizing it. And Dorian, I don't know if you wanted to talk a little bit about some of the really cool stuff you guys are doing for National Health Center Week.
Sure. Hold on. Are you able to hear me? Okay, I think so. Yes, I would love to talk to some of those things, and I did want to follow up. I know that sometimes there's different levels of familiarity with social media, so just to follow up on what Marisol said about the verified page, if you happen to like any company on Facebook, like something that's very big like Target, or if you like a celebrity, sometimes you'll see that blue check mark by their name, and that means that they're verified, and the same thing is on Twitter. However, I did want to say that I'm not sure if it was recently updated, but I do know that you can live stream videos if you are interested in doing something like that. I think you can now do it from any page, but I just think it has to be done from the app on your phone, if I'm not mistaken, because I kind of tested out some things with that. So just keep that in mind if you ever want to do that. The other thing I wanted to touch on was the social media tools that we have. If you look to the left of the screen for National Health Center Week, and many of you have probably seen them and used them, but as always, we have like some sample social media posts. They're available in both English and Spanish, and they're just posts that are, that you can easily, you could copy and paste them if you wanted to. Some of them have like a blank space to include specific information about your health center. You can post them to Twitter or you can post them to Facebook. Also, if you visit the Health Center Week website and go to social media tools, you can actually use, if you can see, it's kind of small, but there's a blue button right in the center of that screenshot, and that's where you can actually click there and tweet about National Health Center Week right from there if you're logged in. The other thing is that we do have photos this year, as always, from the official poster. We've been able to create 2 versions of our official National Health Center Week photos that can be used as a cover photo on Facebook or a header photo on Twitter. And then we also, those images and the language that's in those images is also available in Spanish. The other thing, if you look to the top middle, you can see, each year we make sure that you can easily contact your elected officials. Now with our new platform, it's very easy. You can just ask your elected officials to post about Health Center Week, but you can also send them kind of a letter or an email that kind of explains what it is, as we do every year. But if you look at that screen, you'll see the 2, you can see the text in the middle, and then on the right side, you can see the icon in orange for Twitter, and then the one next to it for Facebook. So if you put in your name, your address, and your zip code, you'll be able to locate your legislator, and then a tweet or Facebook post will formulate, and if you're logged in, as I said, you can click send or whatever it is, and it will go again. It will go automatically post either to your page, depending on how your privacy settings are, or it will post to the legislators page. So just keep that in mind, because we definitely want to keep them in the conversation. And last year, we really did a great job with our presence on social media with the National Health Center Week hashtag, but we also had a lot of engagement from legislators who had made visits and were supporters of health centers, especially in that time of year. So I did get a question just now from Herbert about how can we get verified. I know Marisol has gone through the process, but essentially you can go to if you have a Facebook page and you go to settings, I'm actually going to just look at my own screen right now so I can do it, but if you have your Facebook page and you go to the settings of your page, you can click on those 3 dots and go to settings. You would be able to see everything that's laid out on your page, like, the number of people that like you and all that stuff. There is something there where you can go in and actually you would just click, so you'll see something that says verify or verify this page, and I think there's 1 of 2 ways you can do it, but essentially you put in your phone number of your official business and you should get a phone call with like an automatic verification code. You would put that code like into your computer on the screen, and then it should work. Marisol might be able to speak to that because I know she went through the process. Sometimes it's not that easy because certain businesses' phone numbers, I guess, aren't to an official business, or you sometimes have to show documents. So Marisol, if you want to jump in, maybe you can speak to that.
Yeah, so if you go into settings, I think it's the 4th one down. It says page verification. You click on the edit button, and then it says get verified. So usually what they'll do is they'll have you put in a phone number that's related to, like your office number, and then they'll call you and they'll give you a code and you can get verified that way. Our system did not work that way for whatever reason, and so I had to send in, and they let you do it electronically via the Facebook app. I had to scan a bill, whether it's the phone bill or cable bill or whatever, utility bill, with our organization's name on it, and send that scan in. I also sent in, I happen to have a tax document, so I was able to send that in too. They just want to make sure that you actually do work with the organization and so you have access to that information before they verify you. It took, I think it took about 2 to 3 weeks to get it verified, so if that's something you want to do, I would do it sooner rather than later. so that you can get it in time for National Health Center Week. Other than that, I don't know what their criteria is to be verified, but I have seen, I mean, we have a lot of Facebook followers or likes, but we don't have, you know, the millions that a Target or whatever would have. So I'm not sure, and I have seen some Facebook pages for organizations that are smaller as far as likes and followers, but have been verified as well.
And just to weigh in, Alejandro responded and said that when they got their page verified and they used their Articles of Incorporation and 501c3 number. So, I mean, you know, as long as it's something that is an official, if you can't get through it by doing your telephone number, I mean, I think any really official document that proves that you're, you know, an operating, you know, legitimate business, which all of you are, you know, then you'll be able to do it. So that, you know, that's some good advice as well. So thank you for sharing that. Yeah, if anybody has any questions or about Health Center Week tools or you'd like, you know, different type of materials, please feel free to email me. And also, just quickly, I did want to throw in, many of you have also probably seen our challenge, 100K in 100 days. The goal is to reach 100,000 advocates by Health Center Week, which would roughly be 100 days. I can share out information about that after this, but essentially we have the same tool though where you're able to use the new platform to sign up, and then you'll receive information, but you can also post directly from our website about the challenge, whether you've signed up, whether you've told others to sign up, and also, as I've seen many of you use, there's the Twibbon, the profile badge that says, you know, I'm a health center advocate, and has the Campaign for America's Health Centers logo at the bottom. So just please be sure to participate in that, because that's definitely something that we'd love to achieve, and also it's another great way to get the word out on social media about health centers. So thanks, Marisol.
No problem. I just wanted to also talk about how important it is, whether, you know, for social media, for you to tell your story. I mean, one of the best ways to tell your story is to actually tell your story. So I wanted to just say that, you know, and I love this quote, there are two ways to share knowledge. You can push out information, or you can pull them in with a story, and that's what you want. You want to pull them in with your story. And even though social media tends to be a quick, oftentimes short way of communicating, you can still tell that health center story. You can do that by using imagery, again, keeping it local. You know, people want to hear about what is happening in their community. You know, what programs do you offer that are so unique that, you know, you think these are so great, and that when you talk about them, you get excited talking about them and sharing with your family and friends about what you're doing within the health center. Those are the things that you want to share with the people in your community. You know, show some passion when you're telling these stories, and then show them how they can support you, and keep it simple and clear, because your messages are really important. You know, show some personality, and just, you know, help them get as excited as you are about what you're doing. And you can do that, you know, again, through imagery and showing personality and talking about your health center. Develop a story that's compelling and cohesive, and share that unique value of your brand, of your health center brand. It's also, and like I said earlier, we think of social media as these quick, short messages, and they are that. But you know, a lot of brands actually tell stories within those platforms. You know, you can, for instance, in Snapchat, which is a new, well, relatively new platform that NAC is not on Snapchat right now, but a lot of brands are using it, and the reason they're using it is because it's combining imagery with storytelling. Snapchat, you can snap a photo and upload it to your story. They call it your story, and you can upload a couple different photos to that throughout the day, and it lives there for 24 hours. And so the people that are following you can click on that within their phone and see your story for the last 24 hours. Again, Snapchat doesn't keep your images for more than 24 hours, but it's still a fun tool. People are even using Snapchat for contests. But again, you have to sort of build your audience. You can do chronological storytelling just with these little snapshots. On Twitter, I've seen a couple of different, folks tell stories that just blow up. You have 140 characters, and people are, they get excited, or they get curious about what you're talking about, and then it builds anticipation. They'll keep reading your feed to see what else you're going to post after. So if you have something really compelling and you can cut it up into various parts that are 140 characters, you can do that. And then if you can throw in an image, that's even better. You can certainly do that on Facebook. I think Humans of New York is proof of that. People sort of, it's funny whenever there's a really good Humans of New York that says, post one of like 3, people sit, and wait for this stuff to pop. They check their Facebook and wait for this stuff to pop up, and actually the first post that goes up in the comments section, you'll always see someone say, oh, great, there goes my day. Thanks a lot, Humans of New York, because now I'm waiting, anticipating this story to continue. So no matter what the platform, and whether it's a photo, just an anecdote, or a video, your story should, reveal something, again, show some personality and share why you're unique, something that's unknown about your health center. It should give people the feels, help people connect and feel emotion when they read or see your health center story or the image that you're sharing, in order to mobilize them to become advocates. Excuse me. And it should take your audience on a journey, just like any story. It should have a beginning, middle, and end. And remember that people connect with people and not brands. To connect with your patients, your prospective patients, you need to show your health center's personal side. And you can see, you can sort of see what we talk about when we talk about stories. This is actually from our stories site, and if you guys, this is a quick shameless plug, but if you have a health center story that you think is absolutely wonderful and make a great blog post, and you want us to talk about it, you can email us. My contact information is actually at the end of this presentation, and we can work on putting something together. But what's really great about this story here is that it's a really, Park RX is actually, I think, a national program, but this story is particularly about Unity Health Center in DC. DC is full of national parks and local parks, and so the Park RX program makes sense here, and this story really ties in what this program within Unity Health Center does for the local community. They want their patients to get more exercise in an urban area, but some of their patients don't feel safe in some of the parks and streets that are around their homes. And so how do you tell someone go out and get a walk if they don't feel safe? Well, so they decided that they were going to map the different parks and rate them on safety level and sort of give their patients that tool, and it's been successful. And it just highlights, what's within the community and something easy that patients can do now. This health center actually has done something else too, in that they've partnered with the Department of Transportation to offer low-income individuals reduced, it's a $5 membership to a Capital bike share that lets low-income individuals take bikes and use them as transportation around the city so that they can get around. And it's really just a really great story. So just some quick tips. Don't forget to encourage your local partner organizations to share your social media messages with their followers. If you've planned ahead and you have these Twitter and Facebook messages all ready to go, you know, share those with your local partners, your United Ways, those people who support you, and say, hey, it's National Health Center Week in August. Can you please post stuff about this? Here's some messages. Giving them the prepackaged messages will make it so much easier. They don't even have to think about it, you know. And honestly, during the summer months, finding news and stuff to share is difficult. So whoever's on the other end posting really probably wants that content. So, you know, a quick email saying, hey, help us, support us, you know, we know you love health centers, is great. And thank your supportive elected officials via social media. You know, if invite them to come out. If they come out, you know, thank them afterwards and say, hey, we really appreciate, you know, make sure you tag them in the Twitter post and on Facebook and a tweet. And then also use your staff. I often talk about in my other presentations about whether or not you have a social media policy. So first, if you don't have a social media policy, here's a plug for that. You really need to have a social media policy. It's really important. And you can email me and I can send you a template if you need one. Use your staff. Your employees are your best brand ambassadors. You know, encourage them to share your National Health Center Week messages. You know, when people love the place that they work and are happy to talk about, you know, the great programs and stuff, it really says a lot about your organization and builds credibility and trust among people who maybe have never heard about your health center or about health centers. And so use them. They're really, your happy employees are really great advertisers, you know, word of mouth advertising. Monitor and post regularly. So it's great if you get ahead of schedule and you have scheduled all of your posts, you know, but don't forget to go back and make sure you like people's comments if they're positive, but also monitor just in case things are not so positive, you know, or if there's a concern and, you know, so that you can address it. So don't forget to do that and engage with others. And, you know, if your partner organization posts or shares something that you have sent to them, thank them for that. You can thank them on their own Facebook feed. Engage, answer questions, reply to comments, thank others for sharing. All those things are great things. And then just really quick, these are really cool tools that are free to track and evaluate your messages. So when you post on Facebook, on the back end, you can see, you know, how many likes, how many shares, how many click-throughs, what things people really like and what things just didn't resonate. Use that to figure out what will work when you're planning for next year, or even if you have this information now, what you're planning for this year. Twitter also has an analytics, built-in analytics tool that you can look at and see what your top posts are for the month, and that'll sort of show you. And if you go back because it goes back a couple of months, if you go back, you can see consistently what has worked and what hasn't worked. And then there's also Hootsuite, which is something we use here at NAC to schedule tweets, to tweet and to post to Instagram as well. As monitor what's happening on social media. So Hootsuite also lets you create a sort of basic report, but it still is information that's very useful. So does anyone have any other questions?
Yeah, if you have questions, please feel free to put them in the chat box, and we'll be sure to answer them. Also, just some some plugs here. Please follow us on social media if you're not already. Be sure to follow NAC and CFAC, and of course the National Advocacy Director, Amanda Pierce-Kelly, her Twitter handle is there, HC Advocate APK. And then, of course, you can follow Marisol and I. Our information is there, but if you'd like to reach out to us with any questions after this, you can also give us a call or you can shoot us an email. But please, if you have questions, please share them, and we would love to answer them. And we will also make sure that this presentation, the recording, and the slides are available online shortly after this event. Oh, okay, so a question came in, Marisol, is there a way to gauge how many CHPs are using Snapchat and how are they using it? I personally do not know. I have recently made a Snapchat account just to see how it worked, and then I ended up deleting the app because I didn't have any, I was eating up space on my phone and I wasn't using it. But I'm definitely happy to go on and look and see if I can find anyone. I think the weird thing for me, and this is just my personal opinion, and Marisol, I'm sure you might know a little bit better, is Snapchat, it's hard for me to even figure out like who is on it and all that. The search is just a little bit confusing to me, but I don't know if I'm just doing something wrong. I love most social media platforms, but that's just one I haven't really, dived into. So, Marisol, if you have
yeah, unfortunately, I don't know that I have so much information. I do have a Snapchat account that I just opened not too long ago, and I'm not using very much. And basically, it just took my contacts from my phone and told me who was on Snapchat. So I'm not really sure, and maybe that's something I can look into and get back to everybody, how we would find other health centers that would be using it. I'm sure maybe there's a search function, and actually, let me see if I can search. But that's something that I'll have to look more into. I know the big brands do use Snapchat, but I think it's because they have lots of things they can post about as far as visuals. So like the Targets of the world and things like that can post about new products and things.
And then, I'm sorry, I didn't mean to cut you off.
Sorry, I was just going to say I'll look into it and get back to folks on that.
Yeah, and we did get a comment, Marisol, from Dylan, and it says all Snapchats have a QR code that is a picture that can be searched and added. So thank you for that information. I didn't, really know that. So thanks for sharing that, because I don't know if I would have been able to figure that out. But the other thing is, as far as how they're using it, though, Alejandro, I can't speak for specific health centers right now, but I do know that a lot of elected officials and celebrities, and even like my alma mater, Elon University, is on Snapchat, and sometimes it's really like if there's something going on, like if there is an event, for example, they have something like at Elon called Elon-thon, they will do Snapchats from those, or like sometimes it's more of like a quick message thing if there's something going on, because the thing about Snapchat is you can have different filters and things like that to share your thoughts as well as the photos. So the other thing is if you picture, I think Marisol touched on this, that photos on Snapchat do go away unless you add them to your quote-unquote story. And if you add them to your story, then they'll remain on it. But that's just
yeah.
And we also got some other feedback just saying that from Ricardo that only you can see who's seen your, so only you can see who's seen your images, your followers can't see. So again, I mean, I think that it's just something that we have to research, and we can definitely get back to you with some more concrete information. If there are any more questions, please please feel free to put them in the chat box. You know, we have some time, which we really wanted to allow time for discussion. So. Okay, well, if there are not any more questions, and it looks like there's nothing more in the chat, then I guess we will just say thank you for attending, and we definitely hope that this was helpful. And please remember that we will be back again next month with another topic. And if you do have questions or need to see this again, please feel free to reach out to us, but it will be posted online. And also just special thanks to Marisol for pulling this together and kind of making the series kick off with a nice touch. So I really appreciate that, and thanks everyone. Marisol, if you have anything else, then.
No, just thanks for joining us, and if you have any other topics, you know, in social media that you're interested in listening or learning more about that you think we can help with, please let us know. Just send us a quick email.
All righty. Well, thank you, everyone, and we will be in touch with this presentation. Have a great rest of the day.